Okay, hi everyone. In this short video, I thought about discussing with you guys the clinical aspect of gouty arthritis. Alright, let's dive in. So firstly, I would like to give you guys a brief introduction about gouty arthritis. Essentially, gout is a type of arthritis that happens when there is too much uric acid in the blood and it forms sharp crystals in one or more joints. It is a metabolic disease that results from an increased body flow of urate with hyperuricemia. However, bear in mind that not all patients who are diagnosed with hyperuricemia uh, have gout. On the other hand, gout is typically characterized by episodic acute arthritis or chronic arthritis due to the deposition of monosodium urate crystals in joints and also in connective tissue. And when these crystals deposit in connective tissue, they are called tophi. Alright, let's move on to the causes of gout. There are many causes of gout. Uh, Gout can be caused by increased consumption of purine, such as uh, due to eating shellfish, anchovies, red meat, or organ meat, as well as increased production of urine, such as due to intake of high fructose corn syrup. Other causes include decreased clearance of uric acid, which can occur due to dehydration. Dehydration can be caused by insufficient water consumption or simply by alcohol consumption. In addition to that, chemotherapy, radiation, genetic predisposition, as well as medications like thiazide diuretics and aspirin can also be the causes. Alright, let's move on to the epidemiology of this disease. Nowadays, since high purine content foods are highly accessible, gout has been steadily increasing in its frequency in developed countries such as Canada, the USA, many European countries, as well as China and Australia, with about 3 to 5% of the population in those countries are affected by at least one gout attack in their lifetime. Comparatively, less developed countries have rates of gout less than 1%. Overall, over 50 million people are affected by gout worldwide. Next, in the early clinical manifestation of gout, usually only one joint is affected. However, in subsequent episodes, more than one joint can be affected. The metatarsophalangeal joint of the first toe is often involved, but tarsal joints, ankles, and knees are also commonly affected. Especially in elderly patients or in advanced disease, finger joints may also be involved. Inflamed Hibberdin or buccal nodes may be a first manifestation of gouty arthritis. This picture right here illustrates the Hibberdin and buccal nodes that has been inflamed. So if you can see here, this is the inflamed Hibberdin node and this is the inflamed buccal nodes. Alright, let's go on to the signs and symptoms of acute gout. They include fever, painful, red, hot, and swollen joints with extreme tenderness as well as skin disformation. Alright, I would like to explain briefly about this painful, red, hot, and swollen joint with extreme tenderness first. So, as we all know, uric acid crystal is a foreign substance to the body. Therefore, their deposition will trigger the body to attack them, and this leads to inflammation. This can be a highly inflammatory state, and therefore the attacks can be excruciatingly painful, with red, hot, and swollen joint accompanying the pain. The pain is often described as throbbing, crushing, or excruciating. The pain can be very intense that even a sheet or a blanket placed over the joint is very excruciating. However, bear in mind that some patients may not experience this intense pain. They may experience mild pain and they might not even realize that they are having a gout attack. In addition to the pain, the swelling is also accompanied by extreme tenderness. Skin discoloration is also present and the appearance mimics cellulitis. However, while gout is often abrupt in onset, cellulitis tends to progress from an initial pustule, abscess, ulcer, or patch and gradually expands. Cellulitis may appear similar to gout if the initial location is joint, but the erythema and swelling may enlarge beyond the joint area and affect multiple digits. And if the inflammation occurs at the metatarsophalangeal joint of the big toe, The condition is called podagra, as you can see here on this picture. Besides, okay, let's just briefly compare between cellulitis and gout. As you can see on this picture, the swelling and the redness actually expands beyond the joint, and it affects multiple digits, as you can see here. So one way we can actually diagnose the disease is that while it might initially the inflammation and the swelling might initially occur at the joint, if it spreads to and it affects multiple digits, then it means that it's cellulitis and it's not gout. That's how we rule out cellulitis from gout. Alright, besides, fever may also be present, and if this acute gout attack is left untreated, these attacks are self-limiting and it will subside on its own between a few days to 2 to 3 weeks. Alright, 60% of people who have a gout attack will have a second one within a year. And overall, 84% may have another attack within 3 years if not controlled. There is no pain or joint swelling, but this does not mean um, interval gout is the time between these attacks, and during interval gout there is no joint swelling or pain, but this does not mean that the gout is gone. If nothing is done to decrease the uric acid level during this time, the uric acid will continue to deposit in various joints and tissues, and this can lead to damage. This is an opportunity to start lifestyle change and take medications to prevent future attacks of chronic gout. Alright, let's go on to the next sign and symptoms of chronic gout. So, chronic gout develops in patients with gout whose uric acid level remains high. When this happens, more and more crystal becomes deposited in the joints and connective tissue. The acute attacks also become more frequent and more severe. Joint damage occurs. When uric acid crystals begin to deposit in soft tissue, they form nodules called tophi. Tophi are painless and can develop after a person has had gout for many years. Tophi commonly appears at hands, fingers, elbows, and ears, but they can appear almost anywhere in the body, which can be very disfiguring. Tophi are painless and can develop after a person has had gout for many years. As chronic gout gets worse, flare-ups can occur more often and last longer. In about half of all patients with gout, the first attack occurs in the joint at the base of the big toe. When chronic joint occurs, however, other joints may be affected, including the ankle and the knee. Over time, the inflammation causes permanent damage to the bones and cartilage, and this causes erosions and then functional disability. As can be seen in the picture of a radiograph, severe to facus gout with erosion around the proximal phalanx causes a distortion in the joints. Alright, moving on to the diagnostic criteria for lab investigation. Two of these criteria must be met for a clinical diagnosis to be made. The patient must either have a clear history of at least 2 attacks of painful joint swelling with complete resolution within 2 weeks, a clear history or observation of podagra, presence of tophus, and or rapid response to colchicine after 48 hours of treatment. Alright, this is the picture. This is a picture of the representation. This picture represents the acute joint swelling. And then let's move on to the diagnostic test. There are many diagnostic tests that can be done, which includes lab investigations, joint aspiration and uric crystal identification, as well as skeletal x-ray and renal imaging. But for this video, I will only cover skeletal x-ray and renal imaging. Alright, let's go. So for skeletal x-ray, for acute gouty arthritis, usually the skeletal x-ray is usually normal, although there may be reversible soft tissue swelling around the joint involved. On the other hand, for chronic to facus gout, x-ray findings consist of tophi and erosive bone lesions characterized by punched out lesion. This arrow on the right here shows the punched out lesion or red bite erosions. They are also called red bite erosions because, as you can see, it looks as though it is a red bite. Alright, and then just now I've mentioned that These red bite erosions can be seen in chronic gouty arthritis, but however, these erosions, especially in the foot and big toe, are uncommon. Also, the joint space is usually preserved until late stages of the disease. And just now I've mentioned about this acute gouty arthritis, right? So as you can see here, there in this radiograph you can see a reversible joint swelling. Sorry, a reversible soft tissue swelling around the joint involved. Alright, let's move on to the renal imaging. So the renal imaging can also be done in patient to diagnose patient with gout because the kidney excretes uric acid. So if there is excess uric acid, they can actually affect the kidney and they may deposit as kidney stones. So renal imaging can be done, and there are a few types of renal imaging. For example, MRI. MRI is also known as magnetic resonance imaging. Um, it shows a good anatomical information on an obstruction, regardless of kidney function. However, it is poor in determining the cause of obstruction. Therefore, intravenous urogram used to be investigation of choice for urate stones. However, it has a few disadvantages because it can only be used in patients with impaired renal function, and it could not really detect small